87.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
Hello, hello. Yes, okay. We got echo. We got echo in the headphones. Okay.
Doesn't sound good.
All right, let's see. No, all right, we'll get this figured out. We have a new board in here. We're not on air. We're not on air. We're trying to figure this out. All right. Let's see that. Then we have no headphones with that out. Okay. All right. Well, we're running our maiden voyage on our new digital board here, and we'll figure it out. Bill, how you doing?
I get an echo.
Little slapback echo in the headphones. All right. Anyway, we can handle it, right? Because we're professionals.
Not a problem.
All right.
I had this happen to me years ago. I was announcing races in Skowhegan, Maine, and they had a big bullhorn that was facing right at me, but it was on like a 7-second delay. And every time I would speak, and then I'd hear my voice 7 seconds later, I started to slur.
Are you getting a delay?
Yeah, we're getting a little slapback delay, yeah.
I don't know how to solve that.
Okay. Well, okay. Well, anyway, we're gonna carry on like this, Tim, and maybe during the break we'll come up with a solution. But first,
You know the best
we
thing
have
to
a
do,
big
Billy?
show planned for tonight.
Let's take our headsets off.
Well, we could do that because we don't have any calls right now. We will need it for phone calls, though.
We will need it for phone calls,
so
but until
we
then,
will,
we'll be fine.
Just live without them.
So we got a lot to talk about tonight.
We do. We have a lot of things planned, and
Tomorrow's election day.
tomorrow it's all about election day tomorrow.
We're
Yeah,
going to talk about a couple of the questions tonight, question 1 and question 3.
yeah,
And we have guests that will be,
and a little bit about
Calling
2.
in.
We'll at least hit on 2.
yeah.
Yeah,
But 2 has no excitement to it, though. It talks about
not a lot, but
constitutional convention, and it takes like 28 other states to basically vote. And
So what are we doing now? We're talking about it, right?
yeah.
So save
but-
it till later.
Okay, we can save it till later. It's very uneventful.
All right. Okay. This is the Open Mic Show, heard every Monday night on WHAV 97.9 FM. Bill Macek here with Bill Ellis, and
Let's talk about a cake.
we'll talk about a cake because we need to make sure we get that in because we very much appreciate the birthday cake that Albie D's,
Second generation.
second generation Italian bakery on South Main Street in Haverhill, or Bradford section,
Right.
in Bradford Square. If somebody has a birthday or anniversary, they stand to win the cake, and if it is in the month of December now, we're looking for new people with birthdays or anniversaries in the month of December to call in 978-374-1900, and you'll speak to Chris, our producer. He'll take down the information that he needs to put your name into our big cowboy hat.
And we did have a winner last week.
Yeah.
And the winner was from Salem, New Hampshire.
There you go. Yeah. So we have
Kinda nice.
listeners all over the valley.
And Bill, you were away. You were in Las Vegas, and I know that although I made joke that you were out there losing your shirt, I did see you did come back with your shirt on, but you were out visiting family, I understand. How was your trip?
Trip was good. Weather was beautiful, and now I'm back and fully recharged and ready to rock and roll.
Well, that's good.
All right.
So
So what do we have lined up this first hour?
the first hour, we have the 6:15 on question 3, Casey Suffredini. And Casey is for the question 3. And then at 6:30, we have Andrew Beckwith, who is against the bathroom bill, as they call it. 6:45, question 1. And that has to do with the nurses.
Right.
We're going to have Karen Moore Sr., who's the Vice President of Operation and Chief Nursing Officer at Lawrence General Hospital. And Karen is planning on coming into the studio. And then at 7 o'clock, like this, they believe they're going to be calling in Donna Kelly Williams, who is an RN, a president of the Mass Nurses Association, and she is in favor of passage of question 1. So the two
So people,
topics,
we're talking
major
both
ones.
sides of questions
Exactly.
3 and
Yeah.
then question 1.
Yeah.
And it will give anybody that hasn't had time to really think about and research, if they just listen, they're going to get a lot of good information as to why they either should or shouldn't from the different guests we have lined up for the 6 o'clock
And this is a
hour.
good thing here at WHAV tonight, Billy, because a lot of people go into the polling, they don't read the whole thing.
Right.
And sometimes it's hard to understand. Sometimes no means yes and yes means no.
Right.
In the way they're worded. So this way here, you'll be able to hear both sides and make a determination. So when you go into the polling places tomorrow, you'll be able to put the yes or no.
I agree. And we better take a quick little break so we can get our first guest on right around 6:15, as we've promised, right here on the Open Mic Show on WHAV 97.9 FM.
Open mic.
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
Your membership enables WHAV to remain local and independent. Consider joining at WHAV.net.
Catch the wave.
When the Haverhill School Committee meets, 97.9 WHAV FM is there live from Haverhill City Hall. Class sizes, special education, teacher hiring, and spending are among the topics covered Thursday nights at 7 when the school committee is in session. Presented as a public service from 97.9 WHAV FM.
Say Smith. Mercedes-Benz has for over 50 years. Smith Motor Sales of Haverhill offers new and certified pre-owned Mercedes-Benz SUVs, crossovers, sedans, and coupes. And with its state-of-the-art sales and service facility, Smith is able to offer a different kind of customer experience unlike any other. Countless reasons, one choice. Smith Motor Sales of Haverhill at 420 River Street, routes 110 and 113. There's more on the web at onlymercedes.com.
Community Spotlight.
Can't snag tickets to the Boston Pops holiday concert in the city? The Keith Lockhart-led orchestra is coming closer to home for a December 16th matinee performance at the Lowell Memorial Auditorium, and the Merrimack Valley Chamber of Commerce has tickets at a reduced group rate. Enjoy the 2 p.m. concert for $79.99 by reserving a non-refundable ticket from the Chamber no later than November 12th. For more information, call 978-686-0900. Submit your own nonprofit events and announcements at least 3 weeks in advance. For best results, use the online form under the Contact tab at WHAV.net. In the Edwin V. Johnson Newsroom, I'm Eric Scott.
WHAV. Open mic.
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
And we are back on the Open Mic Show, and sure enough, as I said, we'll just figure it out during the first break.
We did.
The headphones are
not
working
we,
right.
Tim Coco and Chris
We have
Porter.
to give Tim, we have to give Tim and Chris the attaboy.
Yeah, now you mentioned something about when I said Houston, we have a problem here, and you said originally that it would have been Cambridge, Massachusetts that would have been the Space Center.
That's true, but I don't know if I have time to tell that story. Do we have a guest on hold? We have our.
We'll
first,
tell that another,
we'll tell
another
that
night.
some other time. Keep people in suspense.
And on the line, Casey Suffredini. And Casey, can you hear me?
I sure can.
Casey, how are you this evening?
I am terrific. How are you?
Very good, Casey. Now, Casey, if you can explain to us question 3, and you're in favor of the question 3 vote, if you can give our listeners a little background of what question 3 is and why you have taken the position that you have.
I'm happy to. Yeah, so I am the co-chair of the Yes on 3 campaign. I am a transgender man myself, and what question 3 is going to ask voters is whether or not they want to uphold a law that was passed by the legislature and signed by Governor Charlie Baker in 2016 that prohibits discrimination against transgender people in public places like restaurants, retail shops, hospitals, basically everywhere we all go every day when we're not at home and work.
Casey, this is Bill Macek. It makes it easy. You can just say Bill, and you're talking to both of us. But Bill Macek and Bill Ellis here. I was just wondering if you could tell us if this is a first in the United States or where else this type of legislation it has been enacted and how it's been working.
Well, the legislation itself exists in almost 20 other states. And I think almost 300 municipalities across the country. And for several years before it was actually passed statewide in Massachusetts, there were over a dozen municipalities that had these protections in place as well. What is historic about this particular question is we are the first state in the country to ever face a statewide popular vote on whether or not to take these protections away from transgender people. So we have an opportunity here either to show the country that we believe that everybody in Massachusetts deserves dignity and respect, or to be the first state in the country to roll back rights. You know, I really think that voters in Massachusetts are fair, they're kind, they're doing the work they need to do right now to get to know transgender people better, to learn what non-discrimination laws do and don't do, and that ultimately tomorrow when they are asked whether to continue to treat their neighbors with dignity and respect, they will vote yes on this question.
Has there been any polling or any indication as to how it's going?
Yeah, there's been actually several public polls throughout the course of the year, starting way back in May, and then including a couple of recent polls in September. And they all show, pretty high support, almost around 70% for these protections. And you don't really have to look at the polls to know that public support is really that high. You can just look at the anecdotal evidence. The Yes on 3 coalition has over 1,500 endorsements. There are a number of, I think it's almost 20 at this point. It's changing every day because there's so many that are jumping in and doing it. Cities across the state that have passed resolutions in support of a Yes on 3 vote. Haverhill just did that last week.
Matter of fact, we just did it last week,
yep.
Right? Yep.
So there's just tremendous support, whether it's mayors and town councils, whether it's the statewide Chiefs of Police Association, whether it's the statewide coalition against sexual assault and domestic violence, labor unions, businesses large and small. I mean, you name the social or civic or cultural sector, they have gotten on board and endorsed Yes on 3.
Now, Casey, the Massachusetts Information for Voters, that red booklet that you can pick up from the state, it states that against the section, voting no repeals the bathroom bill law and prevents men from entering women's bathrooms, locker rooms, dressing rooms, and intimate spaces. The law violates the privacy and safety of women by allowing any man identifying as a woman, including convicted sex offenders, to share women's facilities. Now, I know that that's a major concern, that sex offenders can walk into a women's bathroom or women's locker room without any recourse.
Yeah, we all believe in privacy and safety, including transgender people. And the good news is this law actually doesn't change that. There was actually a recent study that was put out by the UCLA out in California that actually studied this specific question in Massachusetts during this 2 years that this law has been in place. And it showed that there's actually no relationship between the transgender non-discrimination protections and these kinds of criminal acts in public facilities. There's been no uptick in that kind of activity since the law was passed in 2016. There was no outbreak of that kind of activity dating all the way back to the early 2000s when Boston first put this kind of law in place. It's just not a real thing. And that's why we have the endorsement of the Massachusetts Chiefs of Police Association, as well as the statewide coalition against sexual assault and domestic violence, and 50 organizations that are part of that umbrella organization all across the state saying, we're actually all better off and we're all safer when everyone is treated with dignity and respect. What this question is really about are, young people like Nicole Talbot. She's 17-year-old transgender girl. She's pretty much like any other transgender, she's pretty much like any other teenager. She likes to get on the phone and talk with her friends, go out for coffee, hang out. She likes to go to the movie theater. She wants to grow up someday to become a professional singer, but she's not going to be able to sing in a movie theater, or sing in a musical theater if she's not allowed to access that facility just because of who she is. That's what this question is about, and that's why yes on
So she wouldn't be able to access the theater because she was transgender?
Yeah, that's really what the question's all about. The question is about pretty much any public place any of us go, transgender or not, any day when we're not at home or work. So it's restaurants, it's retail shops, it's hospitals, it's movie theaters, it's musical theaters, any place that serves the public. That's really what it's about. And imagine this, right? Like if you can't go to these places, you really can't live your daily life. You can't take care of your family. You can't just go about doing the things that we all do every day just to make our lives work.
I think the big concern, though, that a lot of people have is I don't think, first of all, there's a major concern that if you're eating side by side with a transgender person, I think the major concern, again, is the bathroom. If you have three little girls that go into a girl's room, and then you have some 6'2" guy walks in there and says, today I'm a woman, and you can't say anything because if you do, and this law passes, that there's penalties up to $50,000 in a year in prison. I think that's what the major concern is for a lot of people on this particular question.
Well, and the good news is that the law actually doesn't permit that. So we're not actually seeing that in practice, but the law also just doesn't do that by the letter of the law. It actually says that it cannot be used for an improper purpose. It has very clear guidelines about how you establish gender identity. You cannot wake up one day and just put a wig on and, walk into a facility. I can say as a transgender person, the process of actually transitioning is a very long process that involves cooperation with the government, cooperation with medical offices. It's just not something that can happen overnight. But, even if folks don't know all the particulars about transgender people and can't sort out all those facts, if it were the case that this law in any way made women less safe, it wouldn't be endorsed by the statewide Chiefs of Police Association, the statewide Major City Chiefs Association, the statewide Coalition Against Sexual Assault and Domestic Violence. They just wouldn't support this law if it actually made people less safe. What it does do is ensure that kids like Nicole, transgender kids like Ian, transgender adults can just go about their daily lives. And there's a lot of kids like that who live in families where, take Ian, for example. He's got a sister. His parents would not support these protections for him if it were at the expense of his sister.
Understandable. And I think that you'll find that 99% of people in Massachusetts are very much in favor, no matter what your sexuality is to be able to go in any public, a restaurant or a theater or so forth. But again, I think the big question is, and you said, it takes a long time to transition, but there's a first day when you start that transition. So if somebody wakes up in the morning and has been thinking about it for a year, that they really feel like they're a woman trapped in a man's body, and they do don a wig and put on a dress to try to act out what they feel that they are inside, and decide to go into that men's room or that ladies' room, that's where I think where the issue is.
Well, but I think we've seen from the actual experience of having this law in place for the last 2 years, from having ordinances like this across the state in place for a decade and a half, from having laws like this in place for multiple decades in almost 24 other states, that there just aren't examples of any kind of an uptick in issues in restrooms when laws like these are put into place. And again, I would point listeners back to that study that just came out of UCLA that specifically studied Massachusetts. And what it studied was some of the cities and towns that had had protections for many years and some of the cities and towns that hadn't. And what they found from looking at the data is not only was there no increase in the cities that had these protections in place, but in some instances, there were fewer incidents than in cities that didn't have that didn't have these protections in place. So, I think what we see at the end of the day, whether you look at the study, whether you look at our anecdotal experience of this law having been in place for 2 years and people not having had these kinds of experiences, and then you look at the safety experts and the safety advocates who've all resoundingly supported Yes on 3, that, I understand if people have not had the opportunity to meet a transgender person, that it takes some time and it's really, normal to have questions. But these concerns just aren't real, and all the facts show that.
I'd like to just jump in and say that this is WHAV's Open Mic, and we're talking about question 3 for transgender rights. We're speaking with Casey Suffredini, and if anybody listening would like to call in, you still have a little bit of time left to dial 978-374-1900, and you can pose a question directly to Casey for the next few moments right here on the Open Mic Show.
I think as a society, Casey, that we've come a long way with transgenderism, if that's a correct terminology. We had in here a candidate that was for Congress, the 3rd Congressional District, Alexandra Chandler. And, first of all, you could never tell, that it was a man at one time. But Alexandra, I found, was very intelligent. And I wouldn't have had a problem with Alexandra representing the 3rd Congressional District, because she was very, very sharp. And, the sexuality thing, I think should be secondary. You want the best person for the job. And that's why I thought Alexandra came across very, very well. As, other candidates did too. But the transgender people like Danica Rome, Christine Halquist, there's a lot of inroads that are being made with transgender people here in the United States. I think you probably admit that things are progressing.
Absolutely. And I think the point that you're making is actually really important, because, what I want voters to be thinking about when they go in and vote on this law, this isn't just about transgender people. This is about our Commonwealth. It's about the character of our Commonwealth, but it's also about the success of our Commonwealth. And transgender people are just like everybody else. We're rocket scientists. We invent patents. We solve illnesses. We're smart. We work hard. We care for our families. But it's hard for us to be successful and to thrive and to offer all of those things to our communities if we face discrimination and harassment just going about our daily lives because of that small percentage of people. It's not a large group of people, but that small percentage of people who would treat us badly and exclude us from things just because of who we are. And so that's really what this vote is about, right? It's about the kind of state that we want to be and the kind of success that we want to have as a state. And that's why, there are hundreds of large and small businesses that have thrown their support behind this law, and in large part because they know that this isn't just the right thing to do, it's the smart thing to do for this state. We're all better off when each of us is treated with dignity and respect. Transgender people are our neighbors, they're our coworkers, they're our fellow worshipers, our friends, our family members. We all do better when all of those folks are thriving. It impacts all of us.
And I think the only argument that people are waging is not about transgender people, but about sexual predators, and they're not one and the same.
That's right, and it's actually very harmful and very dangerous to do anything that would conflate those and sort of equate transgender people with people who would commit crimes. We're not. We're pretty much just like everybody else. We just happen to have this one thing that makes us different. But I understand, those kinds of crimes, they concern all of us. They concern transgender people too. And what I really want voters to know is this law does not increase the likelihood of those kinds of crimes, that if crimes like that do happen, they can still, people can still be stopped, they can and will be prosecuted, and the police are so confident that they can still do those things and that we are not creating a safety risk by supporting transgender people, that they have thrown all of their weight behind Yes on 3. They want to see this pass because it will help them do their job better of keeping everybody safe.
Casey, we wish you well with the election tomorrow. The only caveat is, and it's a sad one, is if there are sexual predators that take advantage of this, it's going to reflect on the transgender community, unfortunately.
Well, I hope that's not the case. There are bad apples out there who will do bad things, and transgender people, just like everybody else, want to see those folks stopped and held accountable.
Excellent.
That's what I hope our neighbors would know.
Well, we're speaking with Casey, and Casey's
Yes on
Suffredini. That's an Italian name.
You got it. Very Italian. You got it.
And we want to wish you well tomorrow's election. We're just a few hours away, and In about 26 hours or so forth, we'll have a good idea where question 3 is in the hearts and souls of the voters of Massachusetts for tomorrow. Casey, thank you very much for being on the Open Mic Show here at WHAV 97.9 FM.
Open mic.
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
It's 6:32.
97.9 FM, WHAV.
That we deliberate and achieve with wisdom and understanding, recognizing the rights of all of our citizens with full regard for the dignity and justice of the individual.
Each week, WHAV News brings you live gavel-to-gavel coverage of the Haverhill City Council. Listen to 97.9 WHAV FM each Tuesday night at 7 when the City Council is in session from the Theodore A. Pelosi Jr. City Council Chambers in City Hall. Presented as a public service from 97.9 WHAV FM.
Say Smith. Mercedes-Benz has for over 50 years. Smith Motor Sales of Haverhill offers new and certified pre-owned Mercedes-Benz SUVs, crossovers, sedans, and coupes. And with its state-of-the-art sales and service facility, Smith is able to offer a different kind of customer experience unlike any other. Countless reasons, one choice. Smith Motor Sales of Haverhill at 420 River Street, routes 110 and 113. There's more on the web at onlymercedes.com.
Wave weather.
Now your wave weather forecast for Haverhill and the Merrimack Valley. Temperatures in the mid-40s tonight with rain around for much of the evening into the overnight with a light breeze. It'll be dry mainly in the morning, then more rain showers, even some heavy downpours and fog in the later afternoon. Temperatures in the mid-50s, 5 to 15 mile per hour wind. And then becoming clear as we go into Tuesday night after some early showers. Upper 40s for the low, highs in the middle 60s for Wednesday, and plenty of sunshine. I'm WHAV meteorologist Brian Ivy. Your next wave weather in 30 minutes.
WHAV Open Mic.
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
And we are back on the Open Mic Show. Bill Macek and Bill Ellis. Tonight we've got a ballot discussion going on. Ballot questions first, and then we'll be talking about maybe even some of the candidates that are on the ballot.
How about those Patriots?
Yeah. All right. Well, in order to be, as we always are, fair and just, we need to have equal time too. So we're giving equal time now to our next person who's on the phone with us, and anybody that wants to speak to the Andrew Beckwith, right? Is that who's up next?
He's the president of the Massachusetts Family Institute.
Anyone that has a question or comment about what he's going to say, he wants you to vote no. So we just did vote yes on question 3. Now Andrew is here to discuss why you should vote no on question 3. And without any further ado, shall we just go right to Andrew? Hello, Andrew.
Gentlemen, thank you for having me on.
Thank you for your time.
Now, Andrew, we just had on Casey Suffredini, and Casey has the opposite position that you have. Tell us why we should vote not in favor.
Sure. I'm encouraging people to vote no on question 3 to repeal the bathroom law, which allows any man at any time to enter any women's bathroom, locker room, shower, change facility, or homeless shelter if they identify as a woman. That violates not only the privacy, but potentially also the safety of women and children in those spaces.
Now, talking with Casey, the question had come up about if you feel that you're a woman. And Casey had mentioned that it takes a long period of time, basically, to transition. But the question that comes up, and they call it the bathroom bill, is if I wake up tomorrow morning and decide that I'm a woman and put on a wig and a dress, and I walk into a ladies' room and there's young girls there. That can be very uncomfortable for the people that are in there. And if the bill passes, if you were a security guard and you said, hey, get out of there,
That's right.
you could face a penalty of $50,000 in a year in prison.
That's right. And unfortunately, this law is already on the books. It was actually passed in 2016 and signed into law by Governor Baker, even though he pledged to not sign it into law when he ran for office. But the vote tomorrow, a no vote, actually takes it back off the books, because you're right, under this current law, and you wouldn't even have to dress up in a wig and dress. I mean, you could go in with your current, whatever you're wearing now as a man, but if you claim to identify as a woman, then yeah, the security guard could get in trouble, up to $50,000 for repeated incidents. And one of the problems with this law is that the definition of gender identity is so broad, there's really no way to police it, to see if people are sincere or not, because you don't need to have surgery, you don't need to have testosterone or estrogen injections, you don't have to have a medical diagnosis or even hold your gender identity or expression consistently. You just have to claim that it's sincerely held. Now, that's impossible to police. You can maybe litigate it after the fact, but there's no way to protect those young girls or women in a locker room or a changing facility or a place like that. If a man wants to come in, as long as he claims to be a woman, there's no stopping him.
So does the current law provide for any type of inquiry by somebody, whether it be a security guard or somebody that works for the establishment, to just inquire, hey, do you realize you're in the ladies' room?
Well, there's a guidance document from the Attorney General's office. Again, this is the Attorney General Maura Healey, who publicly told people who are uncomfortable with this law they should just hold it. But her guidance document says that you should quietly and out of earshot approach someone and ask them if they are using the appropriate facility.
Okay, all right.
And if they say yes, that's pretty much the end of the inquiry. So
Right.
it really sets up a situation where, predators can go into a woman's locker room, and as long as they look and don't touch, there's nothing you can do to stop them.
Yeah, I see where that's going to become an issue, because the conversation was that as far as public places go, and I think you probably feel the same way that most people do, is if you're at a restaurant and a transgender couple or a transgender person is dining beside you, that's not going to be an issue.
Of course not.
But I believe, and that's why they basically pen this as the bathroom bill, is who's going to be allowed where.
Right, and it's places like bathrooms that's really the only area that will be affected if this law is repealed, because the state agency in charge of adjudicating discrimination claims, the Massachusetts Commission Against Discrimination, or MCAD, has already said publicly, back during the debate over this bill, that they process claims of gender identity discrimination in public accommodations because they interpret sex discrimination to include gender identity. But under the existing sex discrimination laws, as you can imagine, there is a exception for single-sex facilities. In other words, it's not sex discrimination to tell a man he can't go to Curves and work out with the women. But under this current law that we're trying to repeal tomorrow, if a man says he identifies as a woman, he has to be able to work out in Curves and use the same locker room.
So that's pretty interesting. So if I see somebody look like Jamie Lee Curtis working out, I can follow her into the ladies' room?
If you identify as a woman, you have a right to be in the women's locker room.
Billy, this not sound too bad.
Come on.
No, I'm just kidding. But no, it's...
Andrew, can you give us any examples of what has occurred since the law has been on the books?
Sure.
That people should know about that relates to the current law and how it has maybe failed in its good intention?
Yeah, well, absolutely. There was an incident at a Target in Woburn a few weeks ago. There's a story about it on the New Boston Post, if you go to newbostonpost.com. There's a 10-year-old girl who went to the women's bathroom. A man came in and tried to open the stall door, then offered her candy. The girl was terrified. She managed to get out, told her parents. Parents contacted the police. They identified the individual from the store security footage. But when they questioned him, he claimed that he identified as a woman. So he had a right to be in that bathroom, and since technically no crime was committed, they're not pressing charges.
And he was dressed as a man?
I'm not sure how he was dressed.
Okay.
My understanding he was actually changing when he was in the bathroom.
But he tried to get into a locked stall where the
Yeah.
girl had gone.
And this is what we brought up in the first half hour, that sexual predators are going to basically ruin it for transgender people because they're going to be painted in the same category, with this happening. If the bill passes, then people are going to be opposed to transgender people based on the fact of what sexual predators do.
Well, if the bill stays on the books,
Yeah.
it's already there.
I mean, it stays on the
Well,
books,
there was,
right?
there was an attempt during the debate of the bill when it was in the legislature being passed. There was an attempt to offer an amendment that would have exempted registered sex offenders levels 2 and 3. In other words, if you're a level 3 registered sex offender with convictions for, sexual assault or whatever, you can't take advantage of this law. You would not be permitted to use this law, even if you claimed a certain identity. And the legislature overwhelmingly shot that down, saying it would dilute the bill.
It's unfortunate because I think there are some good intentions in what we have as a bill, and then there are maybe some deficiencies in maybe the language of the bill. Is anybody trying to add some descriptive language to the current bill that exists?
Yeah, I don't know of anyone that is. We had to do the full repeal because that's how the repeal process works. It's just an up or down vote on the existing law. You can't sort of go in and tweak it or amend it. That would be a different process. It would be much more difficult.
Now, Andrew, with sexual predators, and maybe it's different with every case. If I was a sexual predator and I was involved with children, are you supposed to stay so much a distance away from children, or are they exempt by having to go to the bathroom?
I think there are certain restrictions put on individuals, but let's say, for example, if you're a registered sex offender, there would typically not be a restriction keeping you out of all bathrooms in Target stores or Walmart stores or any type of common public accommodation. You may be prohibited from hanging around a school or maybe the YMCA, but there'd be nothing stopping you from going to a generally accessible public bathroom or even changing facility. There's a guy was arrested up in Andover at Merrimack College. He goes by the name Debbie Moccia, Moccia. You can Google him. And he's a convicted level 3 sex offender. He's got a history of sexual assault and a habit of exposing himself to people. And he has, alias, about 24 different aliases, some of which are female. The current one is a female identity. So per this law, he could go into that bathroom at Target, the women's bathroom. And you can't stop him until and unless he actually does something. So I was a former prosecutor when I was in the Marine Corps, and I was trained. You have to demonstrate motive and opportunity. And what this law does is it gives a tremendous opportunity to those who already have a nefarious motive.
Okay, well, Andrew, thank you very much for taking the time to call in and explain how you see question 3, and you would like to hopefully have people vote no on question 3 when they vote tomorrow.
They can go to keepmasafe.org, keepmasafe.org to learn more.
Okay, keepmasafe.org is for maybe more or review of the information that you've already discussed in parts. But we want to thank you for calling in, and we'll talk to you again, hopefully sometime. Anytime you want to access the airwaves here at WHAV, you, of course, would be a welcome guest.
Thank you, Andrew.
Thank you, gentlemen.
Thank you.
Have a good night.
Have a good night. All right, we're going to take a break, and we'll be right back as we go on to our next question, which is we're going to question 1 next, and we'll do that right here on the Open Mic Show on WHAV 97.9 FM.
Open Mic!
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
We are back on the Open Mic Show, and tonight we're discussing the questions that are on the ballot for tomorrow's election. And with us now we have Karen Moore. She's the Senior Vice President of Operation and Chief Nursing Officer at Lawrence General Hospital, right next door. So we've all heard of Lawrence General.
Well, I'm sure you have.
Yeah.
Boy, we've been very busy lately, especially with the gas explosions and all of that. But I'm happy to be here tonight, Bill.
Well, we're happy to have you here. And you're here to speak on question 1. You are against the passage of question 1. So all the signs that say no on question 1, you go thumbs up when you drive by those, and the other ones you kind of turn a blind eye to.
That's right. I've been very active educating people about no on 1. It is a complicated bill. I applaud you for doing this on your show because people have often come up to us needing education about it and feel very confused about it.
I agree.
Yeah. So it is. So I'm a nurse, and I'm a no. I actually have to be a nurse to be a nurse executive. But in fact, many nurses groups oppose the rigidity, the inflexibility of such a government-mandated regulation. So you have, patient care assignment. Patients are very dynamic. The qualifications and abilities of nurses are very dynamic. And this is a clinical assessment we make every day, every shift, every hour, not a budgetary one. And it's our professional skills we use to make that judgment about how to pair nurses and patients up and how to decide who's going to get care first or the size of a nurse's assignment.
Right.
Let me ask you a question. Is there a problem in the state right now?
Well, in fact, Massachusetts has some of the highest RN levels in the country, including a very high rate of RNs per what we call 1,000 patient days, so actually in the hospital level. And all our staffing is publicly posted. It has been since 2006. You can go on patientcarelink.com and see the staffing for every hospital, every unit, and every shift, the plan along with what was actually provided. So we have a rich source of data about nurse staffing in Massachusetts and report the outcomes and the quality of that nursing care. And on every meaningful measure, we're number 1 in the country with our hospitals, but also for nursing. Very highly educated workforce, so we do very well.
Now, I've heard that there's going to be the chance, if it were to pass, of long waits in, say, ERs, more expensive care, lack of opportunity for care. Is that true?
All those things and more, Bill, because, in fact, this is what happens when you have rigid ratios. And this has been corroborated by independent parties. I call it the declines and delays and dilemmas that rigid ratios would cause. Declines will cause because in order to meet the ratio, which is at all times, so day, evening, and night shifts have the same level of staffing that is prescribed for the same level of staffing for Mass General, for Lawrence General Hospital, for Nantucket Hospital. So right away there, you see a lot of inequity in how those hospitals are paid, the types of patients they take care of, but yet they would be subject to the same ratio levels. And because they need to be met at all times, nurse can't go on a break, and like I said, the night shift is staffed the same as the day shift. And that's where all the cost in needing more nurses comes. So for instance, at Lawrence General, to take care of the same patients we have today, we would need about 50 more full-time nurses at a cost of about $7.9 million. And
just
those
in your
nurses,
hospital alone?
Just in my hospital alone. All across the state, it is well over $900 million.
Right, almost $1 billion.
Who's going to pay for that?
Well, clearly, hospitals get paid differently. It's not that we all have, as the proponents have been claiming, that there are highly paid executives or offshore funds that can pay for this. Hospitals, most are on a razor-thin margin, including 19 of our 62 hospitals are currently losing money. So this will have to be paid for eventually by all of us, but in the short term, the only way to do this is to shrink the size of our hospitals in order to be able to absorb absorb the cost. But what that will do is cause these delays in the ED that you talked about.
Sure.
Right.
Now, who's going to who makes these decisions? Will it be a government? Are we creating a new bureaucracy in government to make sure that we have managed nursing care in the same way we have managed health care?
Well, there's already bureaucracy, Department of Public Health and many other organizations to oversee the quality of care, including nursing care and organizations. But the proponents of this bill, the Nurses Union, have actually selected that the Health Policy Commission do that. And we know the Health Policy Commission has been around a while now to be the watchdog for quality and expense in hospitals. And interestingly now, the proponents are at odds with the Health Policy's own assessment of this bill, which is a cost of over $900 million. And with no evidence of improvements, which the proponents like to point to the California experience. But when the Health Policy Commission studied that, they found that on every meaningful outcome, Massachusetts already outperforms California, including nurse staffing. And of course, what happened in California was so different from what's being proposed on this very poorly written ballot question.
But California has something similar.
Well,
or not even?
You know, it's
Not
a
much.
very shadow of itself. It has less stringent ratios. Those ratios don't include just RNs, but include LPNs, which are not RN level of care. You know, Massachusetts, we have the highest workforce of bachelor's and above educated nurses. So they don't include RNs. Hospitals in rural areas could apply for waivers. There are no fines that go with not being in compliance with the at-all times ratios. So it just really doesn't even compare to what's being
Are there a
proposed
shortage of
in this
nurses
ballot.
now?
We have about a 5% shortage, 1,200 nurses. We judge that at. This would require another, again, this has been corroborated by the Health Policy Commission, over 3,000 nurses. So there you have 4,500.
Now, where would they come from?
Well, they might come
If we're
from
shortage.
nursing homes or from other
Well,
facilities.
that's exactly right. They would be recruited away. You know, we also have an aging workforce in this state with nurses, and we see about 4,500 retire each year. Nursing schools, we have wonderful nursing schools in Massachusetts, produce about 3,500 nurses a year, so there's already a deficit. And of course, half of those aren't even at the bachelor's level or above. They're at the associate's degree or below. And most hospitals have, for years, just been hiring bachelor's nurses or above.
Yeah, I heard the story of how now, and you kind of related to it early on, that you know the patient, you know the level of care. I know they're going to have, for different floors or different units,
Right.
they're going to have different amounts of nurses to be required, right? But still, they're not going to know the individual people that are being cared for and what kind of services they really need to be properly cared for.
Right. Again, an average of 4 patients is much different from a fixed ratio of 4 patients. The ballot question doesn't look all that different than the staffing plan in my own hospital, Lawrence General. And every hospital has to have a staffing plan, and as the chief nurse, I have to demonstrate its effectiveness every year. So, but an average of 4 patients, a nurse could have 2 patients or 5 patients, or a nurse could have, obviously we study patients every year in high-risk areas like operating rooms and labor and delivery rooms and post-anesthesia care. We have one-to-one nursing, and that is adjusted for as patients nurses can take more patients in different areas, but that's very closely supervised and evaluated.
Yeah, but the personalized care
Has to do with
is
yes.
not going to be reflected in that
No.
bill if it passes.
No, not a government mandate. I am sorry, this is on the ballot, as a question, quite frankly. We have been working for years with the Nurses Union to try to come to compromises, and the single-mindedness around ratios being the only solution has actually thwarted many efforts that have gone in place and been proposed, and I really hope after this successful no vote on Tuesday that we will able to get on to more productive discussions and important discussions, because I want you to hear me. We have wonderful nurses in this state, and
Right.
we have
No, I
wonderful
don't think
nurses
this
at
is
Lawrence
reflecting
General
at all
Hospital.
on the nurse
but,
or how good they all are.
That's right.
Right.
That's right. That's
Now, the thing that boggles my mind is the expense. You mentioned upwards of $900 million.
right.
Where that money comes from is going to come from all of us in this room, anybody that utilizes. How is that going to, an emergency room visit could go up 400 or 500%.
Well, I don't know enough about all the reimbursement piece. I just do know that at Lawrence General Hospital, many hospitals like that, we're on these razor-thin margins. And to keep up, I mean, if all these beds are going to close in the Commonwealth, either we create a really big access problem, or in order to give the care that's needed and required of this kind of law, we will have to raise the funds.
Now, if that happens, bigger picture, could insurance companies decide to get out of business in Massachusetts if the expense is just too great?
Well, I will tell you, I would ask the Health Policy Commission. I mean, they watch expenses. We have had cost caps in this state since, 2012, 2014? And, I would think it would be a daunting task for an insurer to see Massachusetts turn in the opposite direction of everything we've been moving towards, which is lower cost, higher quality, more satisfied patients.
Safe to
Why
say we're
would
not
we-
copying this from anybody. There is no other state that has what's being proposed here.
Nothing that's ever been successful. I think there's been about 6 or 7 states have been tried. It's defeated, and it's been tried for at least 15 years in the Massachusetts state legislature. It's been defeated because it is not a good idea.
So no other state has had this then?
That's correct, except
Okay.
for the California experiment, which really isn't comparable.
We've been speaking with Karen Moore. She's the Senior Vice President of Operations and the Chief Nursing Officer at Lawrence General Hospital. She's here tonight because she hopefully has convinced you to vote against question 1. Vote no on question 1 when you go to vote tomorrow.
Yes, get the facts. Thank you for having me here. Again, it's something that may sound good on the surface, but a lot of people that I talk to really understand that it would not be good to mandate this.
Okay.
Thank you, Karen.
Thank you for all the good information.
Thank you.
Okay, we'll be watching tomorrow. Thanks a lot. Okay, we'll be back right after this break on the Open Mic Show on WHAV 97.9 FM.
Open mic.
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
It's 7:01.
WHAV LP Haverhill.
Here's what's happening in local news. The Haverhill Hillies can rejoice as Haverhill High School will be having a girls' softball field installed at the Haverhill High School Athletic Complex. According to City Purchasing Director Stephen Bacuzzo, city officials have awarded a contract of $1.156 million to the Quirk Construction Corporation of Georgetown to build a new synthetic turf field. Bacuzzo confirmed the contract was for Haverhill High School and construction is expected to be finished by mid-May 2019. The discussion on whether or not to build a girls' softball field has been ongoing since 2016, when the City Council unanimously approved the resolution requesting Mayor Fiorentini to support the creation of such a field. The project got approval from the Haverhill Conservation Commission last August. Several city councilors were pleased with the news. Councilor Melinda Barrett said it was great that the field is finally under construction, and the parents have been waiting for a very long time. Councillor Colin LePage believes the project is long overdue, saying, "I'm glad we were able to move it forward." Councillor Mary Ellen Daly O'Brien said she's been working hard with parents for the last 2 years to see this project approved and never gave up. She said it's not right for the high school to not have a field for the girls, mentioning that other girls' softball teams have refused to play in Haverhill due to the lack of a quality field. Officials from the State Department of Elementary and Secondary Education are headed to Haverhill next month to hear residents' concerns related to a proposed Montessori public charter school that could open in the city in 2019. Adhering to the Wildflower Montessori model, the proposed Haverhill charter school would serve up to 240 area students in grades 1 through 8, according to the DESE. Haverhill's proposed new offering is one of 2 being entertained by the Elementary and Secondary Education Division. The Lawrence-based Equity Lab Charter School submitted an application in an effort to open a school catering to grades 5 through 12. While Equity Lab initially planned to invite Haverhill and Methuen students to enroll, the group announced last month the school would only be targeted to Lawrence residents. The change was made because Education Commissioner Jeff Riley ruled the proposed three-city region does not meet a requirement that new charter schools serve districts performing in the lowest 10% of test scores. At the public hearing planned for Monday, December 3rd from 4 to 6 p.m. at the downtown iHub, Haverhill residents are encouraged to offer feedback on the proposed school, as well as support or criticism. A companion meeting takes place December 5th in Lawrence for Equity Lab's offering. The hearings are the latest in the final phase of the DESE's rigorous application process, which could open for business in fall of 2019. Education Commissioner Riley will ultimately decide which of the proposals, if any, to recommend to the Board of Elementary and Secondary Education to be considered. At least one board member will be present at the hearings to report feedback to colleagues. A final vote on the possible grant of charters is expected in February 2019. 97.9 WHAV FM is partnering with the Merrimack Valley Chamber of Commerce Friday morning the 9th to broadcast live from downtown Haverhill for a networking breakfast aimed at helping city veterans get back to work. From 8 to 9 a.m. at 39 Washington Street, job seekers are invited to meet and mingle with hiring managers from companies like Raytheon and UPS and hear remarks from Phil Frechette of the U.S. Small Business Administration. The event is free to those who register in advance by calling the Chamber at 978-686-0900. Residents in and around Sandown, New Hampshire are asked to help hungry neighbors in need this holiday season by taking part in a donation drive for the Sandown Food Pantry that runs through Thursday the 15th. Donation of Thanksgiving staples like stuffing mix, canned gravy, cranberry sauce, and potatoes may be dropped off at Town Hall, 320 Main Street, or the Food Pantry at 1 Hampstead Road. Supermarket gift cards are also welcomed. Families able to donate turkeys are asked to contact Arlene Bassett at 603-887-3453 in advance of any drop-offs. Remember, WHAV is the only Haverhill-based news source. There's always more at WHAV.net. From the Edwin V. Johnson Newsroom, I'm Eric Scott.
From Feature Story News in Washington, I'm Giles Gibson. Iran's President Hassan Rouhani says he'll break U.S. sanctions reimposed by the Trump administration. It's the last full day of campaigning in America's midterm elections, with Tuesday's vote serving as a referendum on Donald Trump's presidency. And the trial of Joaquin El Chapo Guzman has begun in New York, with the Mexican drug lord accused of dozens of murders and smuggling more than 200 tons of cocaine into the U.S.
Wave weather.
Now your wave weather forecast for Haverhill and the Merrimack Valley. Temperatures in the mid-40s tonight with rain around for much of the evening into the overnight with a light breeze. It'll be dry mainly in the morning, then more rain showers, even some heavy downpours and fog in the later afternoon. Temperatures in the mid-50s, 5 to 15 mile per hour wind. And then becoming clear as we go into Tuesday night after some early showers. Upper 40s for the low, highs in the middle 60s for Wednesday, and plenty of sunshine. I'm WHAV meteorologist Brian Ivy. Your next wave weather in 30 minutes.
If you want to know what's going on at WHAV, sign up for the free monthly Wavelengths newsletter online at WHAV.net.
WHAV, Merrimack Valley, open mic.
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
Second hour of the Open Mic Show. Bill and Bill right here.
A lot of controversial stuff.
Every Monday night. A lot of good stuff.
It is really
hear
good.
the one side and the other side, and we let the listeners decide.
We try to be fair.
And hopefully they all go to vote tomorrow, because that is important. They need to vote.
Well, we just had Karen Moore in the studio, and now we have on the line Donna Kelly Williams, and she is for the passage of question 1.
Right.
Good evening, Donna.
She's an RN from.
Hello, how are you?
And she is
Thank
president.
you for having me.
She's president of the Massachusetts Nurses Association. You got to say that, Bill. That's important. She's an important
I
lady.
wanted you to say that, Billy. I want you to earn your keep.
Oh, okay. All right. Hello, Donna.
Hello, how are you?
Great.
Good.
Thanks for joining us this evening. And you are talking on question 1. You'd like to see it passed.
Absolutely. It's the best thing that we can do for our patients that are in the hospital right now is to have a safe limit to the number of patients that are assigned to a registered nurse at one time.
Now, Donna, quick question. Is there a problem in our hospitals right now? Is that why this bill is being presented?
Absolutely. There's a tremendous problem in the hospitals in that nurses are being asked to care for too many patients at one time, and patients are being harmed as a result of it. You could just imagine if you're the patient in the hospital right now, you're there because you're probably sicker than you've ever been, and that you need nursing care. Because if you needed to see a doctor, you could go to a minute clinic or go into the office. But if you're admitted to the hospital, you're there because you need nursing care. And when you put that call light on, because either you're having pain or you're having trouble breathing, do you want your nurse caring for 4 patients or 8 patients when you have to have the call light on to get help?
Now, Donna, they say that if this bill passes, there's going to be a tremendous expense of close to $900 million. Who's going to pay for that?
Well, listen, hospitals are a $28 billion industry right now. Billion-dollar industry. They can well afford to be staffing safely and making sure that the patient is the number one priority in hospitals. For the last 20 years, what nurses have seen is an erosion of the care that we're able to give at the bedside. As patients come into the hospital sicker and sicker and stay for shorter and shorter stays, what we find is we're not able to do the care that we've been trained to do and the care that patients need when they're in the hospital. So we've done everything that we could up to this point, sat on committees and worked through the Department of Public Health and worked through the legislature.
Well, this
and
bill...
in 2000, I'm sorry?
That's all right. No, I thought you were through there. Go ahead. Finish your thought.
So I wanted to finish with the fact that in 2014, we did a ballot initiative at that time as well, and that ended in a compromise so that we now have safe limits in the intensive care units, which is where the sickest of the patients are. And that was a critical first step, but at that time we said in order for that to work as best as it can, we need to ensure that there are limits in all areas of the hospital so that every patient that's in the hospital can be safely cared for.
Now, there's a shortage of nurses, as there is right now, it's my understanding.
Absolutely, that is not correct.
It's not correct.
In Massachusetts. In Massachusetts, we have the second highest registered nurse per capita in the United States, with the exception of one other state, and that's South Dakota. And I don't know how that happened, but what we do have are registered nurses that have trained and been at the bedside that have left the bedside because they can no longer continue to work under the current conditions of putting patients at risk because they're having to care for too many at one time.
So there are nurses that have left because the cumbersome duties of having too many patients?
Nurses are leaving because they're frightened. They know that they can't deliver the care that they are required to do, that they're trained to do, and they have left the bedside. And just as they have in California before they passed a law in California, once there was a safe limit put in place there, nurses that had left went back to caring for patients. And when someone decides to go to nursing school, they want to go to nursing school to be able to take care of patients, and they want to be able to do it the best that they can. And what we found was when nurses were unable to continue to do that, we see nurses leaving in droves from the bedside.
Now, Donna, well, you mentioned that it's a $28 billion business with hospitals in the state of Massachusetts right now. Knowing that if, say the price tag is $900 million, do you think the hospitals are going to look at that and say, well, it's only a fraction of what we have in our coffers, and they're just going to willingly turn $900 million over without asking for more money from patients?
Well, actually, what they can do is one of the things that they can do is actually look at what California did. In Massachusetts, we have this incredible hierarchy of directors and administrators and hospitals. In California, they took the same amount of their budget and shifted 3% of that budget away from administrative costs and put that into patient care. And they were able to use those resources to be able to staff in a much safer way for the patients. Because if you're going to the hospital, you're going there because you need nursing care. That's what hospitals need to be prioritizing. And what we've seen over the years is they have not been prioritizing with the patient first focus.
The other question that I had is so how readily would nurses, if this were to pass in January 1st, 2019 is the date, how quickly could hospitals be up and running with a full complement of nurses?
Well, that would be determined by the Health Policy Commission because it's really in their hands. So once this passes, and hopefully that's what will happen tomorrow, is that hospitals will start to do their planning and will submit their plans to the Department of Public Health and to the Health Policy Commission for implementation. From the experience that we had with the intensive care unit, even though that law was passed in July of 2014, it took almost until early 2017 to be fully implemented. So that gives hospitals plenty of time to be able to meet the criteria necessary.
Now, this bill is just for hospitals, right? It won't.
Just for acute care hospitals.
Okay.
Acute care hospitals.
And it won't roll over into, say, nursing home care or anything
Not
like that?
this ballot question. No, this is just for acute care hospitals.
Do you think it will take from the staffing at say, nursing homes, because now there will be more job opportunities at the acute care hospitals?
No, I don't. And the reason I don't feel that is because every nurse goes into a different specialty that they either desire or have always wanted to be. My entire career of over 40 years at the bedside has been taking care of babies and children and new moms. That's always been my specialty, and just as I have not done long-term care or nursing home care, that's a specialty all to itself, and there are many nurses that they cherish that opportunity to work with people that are in that setting of long-term care or rehab care.
It's a very good answer, and us lay people would never think like that as to what what you just answered. So thank you for that answer. We're going to take a short break. Would you mind holding on, and we'll be right back and continue our discussion?
I'd be glad to.
Okay, keep it right here on the Open Mic Show. We're discussing the ballot questions, and right now we're talking with Donna Kelly Williams, and she is the president of the Mass Nurses Association, and she is in favor of question 1. We'll be right back on the Open Mic Show on 97.9 FM.
Open mic!
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
Stay informed each day with local news, coupled with FSN's worldwide coverage. 97.9 WHAV is the only Haverhill-based news source. There's always more at WHAV.net.
Paul Ryan, HHS class of 1971, and Tommy Morgan, HHS class of 2013, are good sports. They're on 97.9 WHAV FM every Wednesday night from 6 to 8. Ryan and Morgan talk about local high school sports, the Patriots, Red Sox, Bruins, Celtics, and more. You can join in with your calls. Good Sports is sponsored in part by attorney Gerard LaFlamme, Ideal Frame, Brian S. Dempsey Insurance Agency, Levitt's Auto and Truck, and the Chicken Connection. Good Sports every Wednesday night at 6 on the Wave 97.9 WHAV FM.
Community Spotlight.
Traditional Armenian food and raffles are planned for Friday, November 9th and Saturday the 10th during the Armenian Church at High Point's annual Autumn Bazaar in Haverhill. From 11:30 a.m. to 6 p.m. on both days, parishioners and community members are invited to sample fare, including lamb and chicken kebab, and enter for a chance to win baskets and cash prizes. All activities are at 1280 Boston Road on Haverhill's Route 125. For more information, call 978-372-9227. Submit your own nonprofit event and announcements at least 3 weeks in advance. For best results, use the online form under the Contact tab at WHAV.net. In the Edwin V. Johnson Newsroom, I'm Eric Scott.
Open mic.
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
And we're back on the Open Mic Show. Tonight we are talking about the ballot that you'll be making your marks on tomorrow. And with us on the phone, we have Donna Kelly Williams, an RN and president of the Massachusetts Nurses Association. And we're discussing why she believes, on question 1, you should vote yes or vote for its passage. And let's bring Donna back up on the phone line. Hello, Donna.
Hi, thank you.
Okay, we're back.
Donna, quick question. On your website, it says 8 in 10 nurses, 81% approximately, report that hospital patients today are sicker than hospital patients 10 years ago. Why is that?
Well, you don't go into the hospital unless you need to have nursing care. So many of things that we used to admit patients to the hospital for are done on an outpatient basis now. So you're only brought into the hospital if you need to be monitored very carefully and that you need nursing care.
Now, why is that, though, where more people are, stay in the hospital? Has it anything to do with hospital insurance costs?
No. Oh, no. If you're in the hospital, you're there because you're sicker than you've ever been.
No. I'm trying to say for people that don't stay, is it the hospitals try to push you out if they feel that you necessarily don't have to stay overnight?
No, I don't get that impression at all. If you're in the hospital, you're there because you need nursing care. When you are ready to go home, we discharge you as quickly as we can. And sometimes it's a little quicker than we'd like you to be going home because we used to have a lot more time with patients. But now not only do we have less time with patients, we have more patients. And things are very, very complicated when you transfer from being an inpatient in the hospital to going home to continue your recovery. And anyone that's done that knows that we have to make sure that you understand the medications that you're going to be on, that you understand any treatments that you're going to need, that you understand when things are not going in the right direction and you need to call your physician or your nurse practitioner. All of those things have to be explained and taught before a patient goes home. So you have to be ready to be able to receive that information and not be rushed through it so that you will understand and will recover.
Now, Donna, what are the positions of doctors taken with this?
Well, it really depends. I think that doctors that are concerned are voting yes, and doctors that work very closely with nurses in the hospital. And we've even seen a change with that. Your regular doctor that you see outside the hospital is not the same doctor that takes care of you when you're in the hospital.
Right.
We have hospitalists now that take care of patients that are in the hospital, and they know firsthand how difficult it is for nurses when they have too many patients, and they know what happens when we see the increase in infection rates and we see nurses not being able to get to patients in a timely manner. So those doctors are absolutely in favor of having safe limits for the nurses.
So in simple layperson's language, is it safe for me to assume that if this bill passes, there will be more nurses on the floor than there are today?
Absolutely, yes.
Okay. So that you think will bring more care because there'll be more attention given. I've heard, though, that you won't have the ability to really give specific attention to the different patients with different needs. Do you think that's a problem? to work out?
That's absolutely in the ballot itself, and that's what's called the acuity tool. And the acuity tool is an assessment of a patient as to the amount of nursing care that they require. So if a patient needs more nursing care, that particular patient would not be assigned to a nurse in the same way that somebody that needs less care. So that there is an opportunity within the ballot question to be able to change the number of patients based on the needs of the patient. This is about having a safe limit, not having a strict ratio, but to have an absolute limit to the number of patients that are assigned to a nurse at one time, based on the needs of the patient.
And so this question will set a minimum, but not a maximum.
It sets a maximum, not a minimum.
It sets a maximum. So
Right. So, for example, if you're a patient on the floor, you or I would be on a medical surgical floor as an adult. And based on all of the research, the nurse taking care of a patient on that floor would have no more than 4 patients. But if the assessment or the acuity tool says that that patient, for example, needs more nursing care, that nurse may have 3 patients. And some of the factors that would come into that is if you were blind, or if you were missing a limb, or if you were much sicker, your nurse would have less patients.
Okay, I was trying to say what you said, but you just presented it differently. So a individual nurse will have a maximum, but not a minimum.
Correct.
Got it. Okay. All right. Well, I want to thank you for your time, for calling in and giving us all the information so that the average person can understand what this ballot question is all about. And we'll see what happens tomorrow.
I hope so, and I hope everyone that heard me speak tonight knows how important it is to vote yes on question 1 tomorrow. Vote with the nurses and vote yes on question 1.
Thank you, Donna.
Thank you very much for your call.
Much.
Okay.
Good night now.
Good night.
Bye-bye.
Good night.
All right.
A lot of things to digest, William.
Yeah, absolutely. She brought a lot of information out in more common understanding for me, at least, and I'm sure many of our listeners have the same better understanding. Her name was Donna Kelly Williams. She's an RN, president of the Mass Nurses Association. We're very happy to have heard from her, and we have a few more guests coming up. Geez, I don't know. A long time.
When you were born?
I try not to have that happen.
Geez, I know.
So anyway, it's been quite a while. I'll think about that and get back to you. Anyway, with that being said, this is the Open Mic Show. I'm Bill Macek. Bill Ellis is here with me. We are talking ballot issues tonight. If you have anything you'd like to talk about, give us a call, 978-374-1900, and we will be right back after this short break on the Open Mic Show on WHAV 97.9 FM.
Open mic.
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
It's 7:26.
This spot could have been yours. Support WHAV's local approach with your underwriting. Go to WHAV.net and click on advertising to reach thousands of new customers.
Catch the wave.
Hi, it's Gary LaPierre. I worked for WHAV. It was brief. Long story. Tell you sometime. Anyway, become a WHAV member or renew your membership now. Just visit WHAV.net and click on the membership tab.
Wave weather.
Now your wave weather forecast for Haverhill and the Merrimack Valley. Temperatures in the mid-40s tonight with rain around for much of the evening into the overnight with a light breeze. It'll be dry mainly in the morning, then more rain showers, even some heavy downpours and fog in the later afternoon. Temperatures in the mid-50s, 5 to 15 mile per hour wind. And then becoming clear as we go into Tuesday night after some early showers. Upper 40s for the low, highs in the middle 60s for Wednesday, and plenty of sunshine. I'm WHAV meteorologist Brian Ivy. Your next wave weather in 30 minutes.
Catch the wave. WHAV. Open mic.
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. Call 978-374-1900. That's 978-374-1900.
All right. We are back on the Open Mic Show. I guess we could call this Election Eve, right?
Wow, it's kind of an excitement to it, doesn't it?
Like Christmas.
The clock is ticking down till 7 a.m. on
That's
Tuesday
it.
morning, November 6th. Who will win?
Yes, we'll find out tomorrow.
Yes.
But, and it's no longer just one day. It's now
Oh, yeah, it
it's
leads
like
up.
weeks,
You
right?
early voted, right?
No.
You didn't early vote?
No,
Okay.
I think it's unconstitutional because if you read the Constitution, it talks about the day, the election day, not days. But I'm not challenging it, but I'm a stickler like that. Anyway, I like to vote on election day. I find it exciting. My wife and I go and we vote. And anyway, with that being said, we have a caller on hold, and we're going to talk to our caller before we get to our next guest, who is sitting between us. If you're watching, and we're not telling you who this secret agent is. All right. Anyway, let's talk to our next caller. Hello, caller. Who do we have?
Hello.
Who do we have on the phone?
This is Alexandra Chandler.
Alexandra, how are you?
Good. How are you? So election eve on the night before election, not a sound, not a sound in the house, not a creature was stirring, not even the phone.
We mentioned you earlier this evening,
Right.
Well, I thought you might have been referring to me with the secret agent bit.
Yes,
So,
well, that too,
I
but
mean, yeah, but
no, actually,
So
we were talking about question 3, and
we were talking with Casey Sefrandini, and I mentioned your name earlier.
Casey's great. Oh, lovely. Thank you. And thanks. And the ballot question discussion is good. I was just listening earlier to the Massachusetts Nurses Association rep. I'm myself a yes on question 1 for what it's worth.
yeah, okay.
Yeah. Yep. And then and
of course you're voting
where I stand on 3.
yes on 3.
Yes on 3.
Yeah.
Alexandra, what are you doing now since the election results in a vote in your favor?
Well, I'm sending a lot of thank you notes, and it's on that subject that I actually most wanted to call just to say thank you to everyone in Haverhill, the surrounding towns that supported me. It really gets you right there sometimes, just the amount of people that come together to help you. And in my case, I've got at least 700 more to go. And other than that, I've been helping in other campaigns that I care about. I mean, I endorsed my former competitor, Lori Tran, for Congress, and those voting tomorrow, I urge them to support her. And then, other than that, yes on 3. I'm also busy with yes on 2, the effort to set up the commission to study how we can pass a constitutional amendment to get big money out of politics.
Now, doesn't it take 28 other states in order to vote?
It does. That's why I talk about that as a small step on a very long road. But it's also a constitutional amendment might not be the only way that ends up. I mean, if you exert a certain amount of pressure in enough states, but then Congress will go a certain way, and the Supreme Court might choose to clarify its jurisprudence on the subject. Maybe you don't need a constitutional amendment in the end, but.
What did you think about the photo finish in the 3rd Congressional District this year?
Well, I mean, it was something to behold. My heart went out to both Lori and Dan for that result, because it's one thing to get to that night and it doesn't go your way and you start to move on. I went with my stepfather and my dad out sailing for the day. It's a great way to clear your head. But I had that option.
But let me ask you a question. Even though you were feeling the wind in your hair, you still had to be thinking about the election.
Oh, it's a process.
You can't escape
it's a
it.
Process.
Yeah.
No. It's a process. And, I mean, again, for me, the overriding feeling is just plain gratitude.
Well, I think you ran a very good campaign. You had great support behind you, just not quite enough. But I thought your message and what you stood for and how you proved that you were a worthy candidate for that seat. I'm sure that we hope to see you again on some other ballot someplace down the road.
I appreciate that.
And Alexandra, I'm a conservative, and I did say, though, I would have given you a shot in Washington. That's how much I was impressed.
Oh my gosh, I appreciate that. And, I was honored to have quite a few Republican supporters, conservative supporters. I like to think we pulled throughout the spectrum. And, of the money we spent $29 for every vote we got, whereas some of our competitors were $70, $150. So I'm proud of that. We were lean and mean. We ran on a lot of volunteer strength, and I'm going to stay involved. In everything from what this Yes on 2 effort builds, like a citizens commission to look at that, to, my son goes to Walnut Square. I'm on the Walnut Square Site Council,
Yeah.
Act locally. That's where you make a lot of difference.
Yeah, so absolutely don't be a stranger to the open mic show.
Nope.
Call in. You got anything you want to talk about, we'll bring you in as a guest. Thank you for what you've already done for us and for our area with your messages, and we'll talk to you soon. Thanks for calling in tonight.
Thanks, Alexandra.
Thank you
Okay.
so much.
Bye-bye.
All right. That's Alexandra Chandler. She's from Haverhill, and she ran a very respectable campaign.
The 3rd
looking for
Congressional
the 3rd
District.
Congressional District. She didn't make it, but her messages were heard, and I
There were a lot
thought
of good
she made
candidates, Billy.
She made a lot of good sense. Yeah, she referenced so much good information. Very smart woman. So anyway, with that being said, we're going to let's at least introduce our live guest here. Rich Porcelli, right?
Porcelli, yes.
Yep, and you are with the Kiwanis Club, and we're being told by our producer we have another call on hold, but you're going to talk about something that's coming up. We've got the 3rd annual turkey drop that's going to happen on Saturday, November 10th. That will get people interested.
Well, this was created from WKRP, correct?
WKRP, that's right.
Essentially, yeah.
Yeah, but we've done a little differently in this day and age, but we have the same excitement that if anybody remembers that show. I was old enough to remember.
And I hope we have the same excitement.
I'm sure you do, yeah.
Did you watch the show, Billy?
Yeah, I saw that show multiple times.
Yeah, there's Lonnie
of course.
Anderson.
Yeah. No, Les Nessman.
Yeah.
All right, we're going to take a commercial. No, we're not going to take a commercial.
We're going to telephone call.
Take a telephone call, and Christina Eckhart is on the line. Christina is still in the race, and her big day is tomorrow. Christina, how are you?
Hi, I'm doing great.
Great. Well, I want to thank you for calling in tonight, and we want to hear a little bit about you because you are on the ballot tomorrow for a portion of Haverhill and 3 or 4 other communities that you're going to be representing if you're successful for your bid for state representative.
That's right. There are actually 7 communities altogether.
Wow. Okay, that's almost like a Senate district. So tell us how you're doing, how you're feeling, and tell us.
Well, we're excited. We've been knocking on doors. We've been connecting with a lot of people, and we think we are in a good place.
Great. And you can't go out this late and knock doors, right?
I'm sorry. I don't knock at night. Nobody wants to see you late at night.
Nobody wants to see you after dark, and now that the clocks have rolled back, it really has shortened up your day.
Christina, how many households would you say that you visited during your campaign?
Me personally, or the whole, myself and my volunteers?
Yourself.
Just myself, maybe about 3,000 to 4,000.
Jeez,
it's a lot.
Now, do you remember everybody?
I remember many of them. I'm on round 2 right now, recanvassing, and I've met a lot of people that I've met before, and I remember them, and they remember me. So that's kind of cool.
Yeah, and I'm sure you listen, and you're getting a good understanding of what the people you'd like to represent are looking for.
Absolutely, yeah. That's one thing I ask at every door, what issues are important to them. Because that's going to hone what I do at the State House. Is the first things that I tackle will be the issues that are important to the people I've met at the doors.
What are the most common things you're told they'd like to see happen?
Well, a lot of them are talking about the Merrimack River, the problems they're having with the rain whenever there's a sewage overflow with the rain, and people definitely want to see that cleaned up.
Absolutely. I know the people in Haverhill all want to see that cleaned up.
We have a local expert that listens to the show that would probably be able to give you a lot of insight. Jerry, and Billy, what's Jerry's last name?
Jerry McCall. He's a retired Mass DEP guy, and he really knows his stuff. And if you'd like to talk to him, we can help coordinate that.
Oh, yeah,
that
definitely put
telephone
him
call.
in touch.
Yeah.
You know,
He may
definitely
even
would
be
like to
listening
talk
right now because he listens. He's an avid listener and an avid caller. But tonight we've been talking about many other things. So, is there any other message or just you'd like to? I'm glad you checked in. I know that I extended the offer to you, and thank you for taking the time out of your busy schedule night before an election.
I just want to, send a message out to everybody to get out there and vote. It may be a rainy day tomorrow, but go ahead and make the effort. Get out there to the polling places. My polling places are in Bradford and at the Kennedy Senior
Circle,
Center.
yeah.
And definitely get out there and get your voices heard because it's important. It's important for everybody to participate in democracy.
When Bill Macek ran for city council, his motto was vote early and vote often.
Didn't make that up, but
well, it worked for him.
Yeah, it worked.
Because people love him. How could you not like Bill Macek?
Impossible.
Yes, thank you very much, Christina, and we'll I'm sure be in touch after the election, and I wish you well tomorrow. Thanks for calling in.
Good luck
Thank
tomorrow.
you so much.
Okay, all right.
Take care.
That's Christina Eckhart. She's running as a first-time candidate, but I think she has run an excellent race, and I think that the incumbent is probably going to see a challenge come from Christina Eckhart in the election tomorrow. She's representing 7 different communities, including a portion of Haverhill. So, with that being said, keep her in mind when you're making your decisions for the election tomorrow, although I heard upwards to half the people have already done early voting. It's
I've heard
becoming
that.
very popular.
Yeah, very popular.
Yeah, so anyway.
And you're trying to ruin it by saying it has to be same day.
Well, I just told you, I'm kind
You're
of...
a constitutionalist.
I'm a constitutionalist, and I go by the Constitution. I actually pulled it out and read it when they started this early voting, and it talks about election day, not election days. So I question whether or not it comports with our U.S. Constitution. That's all.
Understandable, but
Nothing
you should
major
just
here.
take it to the
I'm not
Supreme
waging
Court.
a challenge. I'm not starting a group or a committee or anything. But you know what? If you don't like it, change it. Right now, if they feel there should be days to vote, then and there's been talk about moving the election day to a Saturday. Sometimes you hear that kind of stuff.
Actually, that would be a better idea.
But you got to change the Constitution then. All right. Anyway, enough of that. You get me on these tangents.
I'm sorry, Bill.
All right, let's talk to our guest here, who has been
something
patiently
humorous.
waiting to talk
I'm
about.
stuck in the middle of
Yeah,
these
that's
two.
right. That's
a song by
Yeah,
Steelers Wheel, wasn't it, Bill?
We're
Stuck in the middle
volleying
with you?
back and forth. That's right. All right. Kiwanis Club on the 10th of November, coming right up on this coming Saturday.
Yes,
is going to be at Murphy's Garrison Golf on Hilldale Avenue in Haverhill, and you're going to be doing the 3rd annual turkey drop. It's the Kiwanis Club of Haverhill is doing all this, and you're a member of the Kiwanis Club, and I think somehow you got yourself involved big time in this, right?
Well, it started out as my idea. A couple of years ago, I was driving around, and I saw a sign for a golf ball drop, and I thought that was great, except for only one person could win. So I said, well, what can we do differently? And I had at first thought, drop footballs onto a grid of 400 squares, and then we kicked it around and we came up with turkeys. And as soon as that was said, I pictured Les Nessman with his headset and his microphone and his scarf on, describing the turkeys falling out and the humanity of it. And
right.
What a great episode if you know that episode. And
oh yeah.
And where did the turkeys land?
and Chris, you have some of those. You got Les Nessman queued up for us. The humanity, Les Nessman.
And that was a takeoff of the Hindenburg.
Let's see.
He modeled his speech after the Hindenburg speech.
Right.
But yeah.
Right. All right.
Oh my God, they're turkeys! Johnny, can you get this? Oh, they're crashing to the earth right in front of our eyes! One just went through the windshield of a parked car! This is terrible. They're just running around pushing each other? Oh my goodness! Oh, the humanity!
All right.
You know what's funny thing about raising money and so forth? I was at I announce horse racing at county fairs.
Right.
And there was one up in Franklin County in Malone, New York. And they play what they call Bessie Bingo. You know what that is?
I don't.
They have a
Oh,
big
cow?
sectioned off area,
I just
and
kinda
they put
figured
the
it out.
cow in there, and
Yeah.
it's like, I don't know, like there's 100 squares that people buy, and so I see they put the thing in there, and they say, Bill announced about Bessie. So I said, Bessie's now going to do her thing, and luckily you'll be the winner. And I went, like that. Cow turned and looked at me, and then proceeded to turn somebody's winning ticket into
turn somebody into a
winner. Yeah.
Yeah.
Thankfully, people didn't have to wait too long.
No, thank
I've
goodness.
heard that those things have gone on for hours waiting for the cow to
So if
make a
somebody
winner.
wants to help sponsor this event or be at that event, tell us how they go about doing that.
Well, if you want to buy a ticket, there's some left here at the studios. You
WHAV,
can
yeah.
come by here and pick one up, or you can email me and we'll figure a way to get it to you. My email for this is Harold Kiwanis Secretary, all one word, at Comcast.net. You can also visit Haverhill Bank or Pentucket Bank downtown, ask for a ticket. I believe there's still some there. Or you can just come by. There should still be some tickets on the day of the event.
And
That's
it's
at 1 o'clock.
$10, right?
It's $10, and what the $10 gets you is a square on the grid. And for every rubber turkey, we don't drop real live turkeys, so nobody will be saying that fine.
No frozen turkeys?
No frozen. Well, there's frozen turkeys, but those we give away
Those you
later.
give away later, right.
So how do they throw the turkeys on there? And
It's safe.
We actually we hire a helicopter.
You do?
Yep, from
Okay.
Boston Helicopters, Giselle, his second year doing it for us, and he flies over and he drops them out, and he kind of hovers around a little bit and spreads them out, and any that don't land or that fall off the tarp, we actually have a guy dressed in a turkey suit, throws them back on.
But he drops rubber turkeys.
He drops rubber turkeys. We have 100 of them, and for every turkey that lands on the grid, which is every turkey, there is a prize attached to it. So if you have ticket number 127 and 3 turkeys land in your square, you're going to get 3 prizes.
Wow.
That's pretty
All
neat.
right, so that's a good deal.
And you know what? It's fun seeing 100 rubber turkeys falling out of a helicopter.
And it's all
Does
for
he
a
throw
good
them out all
cause.
at once?
Yeah, essentially. I mean,
Wow.
it
So it's
dribbles them
basically,
out, but it takes about
so if
5
somebody
minutes.
was driving by and looked up in the sky, they'd see 100 rubber turkeys dropping.
Absolutely.
Wow.
And it's a fun time. So come on out and watch the turkeys drop.
And it's a good cause. It's for the Kiwanis Club.
It's for the Kiwanis Club, and with the money that we raised last year, we raised a little over $5,000. We gave away $5,000 in scholarships to the local schools.
That's fantastic.
Yeah. It
Do
all
you have,
stays
do you have
right
to be
here.
present to win?
You do not have to be present to win. So, and we'll on the the ticket has information for us, your phone number, your email address, and we'll make arrangements to get you whatever prize you want if you're not there.
Excellent.
They'll fly over your house and drop it.
That would be nice.
They have your address.
Yeah, just hopefully you don't win
And
one
then
of the frozen turkeys if that's the case.
Right.
And they said-
Exactly.
You call the police and say, I just had a turkey drop through my window.
Yeah, or through
But it's
What if-
okay because I
through my
won it.
roof.
Yeah, what have you been drinking?
All right. Hey, we're going to take a short break. You want to hang around and
Sure,
talk a little more? And,
absolutely.
Yeah, we'll get you in this game before you know it. Anyway, we are the Open Mic Show on WHAV every Monday night, 6 to 8. Bill Macek and Bill Ellis right here on 97.9 FM.
Open mic!
Bill Macek and the Open Mic Show will be right back. Get in on the action. Call 978-374-1900. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495.
Try listening to WHAV in your car or anywhere on your mobile phone. For fast access, visit WHAV.net.
Catch the wave!
Suspense, a weekly anthology of notable melodramas from stage and screen, fiction and radio, presented every Monday night to bring you to the edge of your chair, to keep you in suspense. Listen to the new Suspense with a company of Hollywood actors and surprising guest stars, Monday nights at 10, with encore performances at 1 a.m., right here on WHAV. Remember, only local radio can bring you this feature opportunity, but only WHAV does.
WHAV Open Mic!
From the Edwin V. Johnson Newsroom, 97.9 WHAV FM presents The Open Mic Show with Bill Macek. Open Mic is brought to you in part by Smith Motor Sales of Haverhill, 420 River Street, exit 48 off 495. Make your voice heard. call 978-374-1900. That's 978-374-1900.
And we're back. And we are taking it right up until 8 o'clock now. We have open lines at 978-374-1900. Any topic you'd like to discuss. Also, if you want to talk about the ballot that you're going to be voting on tomorrow, pro, con on the questions, or if you even want to talk about maybe your favorite candidate, would let you do that.
Now, is that ballot or ballad, B-A-L-L-A-D? Because I'm going to ask you a trivia question because you're real astute with music. Who wrote the song or recorded the song, the Ballad of the Green Beret?
Sergeant Barry Stadler.
Oh, sadly, Billy, you can't be beat.
No,
talking about music, I saw Bohemian Rhapsody over the weekend.
Yeah,
fantastic.
Yeah, it looked. I've seen the previews.
I would recommend going to see it. That the actor, it looks just like him and acts just like him. He did a tremendous job.
Who's him?
His name is Mackie something or other. He's
no. Who's
Freddie Mercury?
Freddie Mercury.
Right, exactly.
Him.
See, people know though, Billy. When I type Bohemian Rhapsody,
not
what
some
it's
of
about.
the younger people, they may not.
He still has a big following,
Yeah.
even though he's been dead for quite a few years.
Oh, I'm sure. Well, I mean, what a voice,
Well, they also had a Broadway show, which I work at Whittier Tech. We did it last year on stage called "We Will Rock You," and it's all based on the music of Queen.
Okay.
So
all right.
yeah, there's still a huge following with the younger generation.
Yeah, great. Well, that's
you talk about
so.
his voice. He never got his teeth fixed because he felt that if he did, because he had a terrible overbite, that it would affect his singing, and it probably would have.
Might have. Yeah.
No, that was a great show. Now, what are some of the prizes that the folks can win with the Kiwanis Club Turkey Drop?
Well, we do have a dozen frozen turkeys being donated, so those are 22-pound turkeys. So there's that. There's a lot of them are gift cards from like Dunkin' Donuts, Mr. Donuts. We got some coming from Five Guys. Wicked Big Cafe, Pizza De Forno, and Haverhill Beef donated some cards to us. A lot of the prizes members of the club buy and donate to the cause.
So it's safe to say every prize you can eat.
Just about, yeah.
Well, talking about eating well, we got a caller online for the LBD's second Italian generation bakery.
Trying to win the free
the free cake,
either birthday or anniversary cake. We have a caller on the line, so let's go to our caller. Hello, caller.
That's right. It's birthday time for December birthdays.
Brian, how are you?
Okay, how are you?
Now, you going to say Jesus? Because his birthday's in December.
Well...
I don't think you could take claim to...
Well, it's a...
You're talking about a different calendar, though. That was the Julian calendar.
Well, December 25th. So you don't necessarily...
I know what day Christmas is.
All right. Brian, who are you calling in for tonight?
I have two birthday people. One is Mark, and the other is my cousin Madeline.
Mark and Madeline.
Madeline.
Yeah.
Now, Madeline, an older person, because that doesn't sound like a younger person's name. Names go through phases.
Well, no, she's not that old.
Well, Maddie, that's kind of what Madeline has probably become. That's not that old of a...
I've heard that before.
Yeah. So, well, anyway, they're both having birthdays in December. And
December, what are the days in December?
Let's see. I'm not sure.
You know them really well, huh?
Did you give them...
Cousin Madeline is December 6th.
December 6th, okay. And you gave all this information to our producer, Chris.
Yep.
Okay.
Yep, Chris knows.
Yeah. And
Chris knows Mark, too, but
okay.
I forget the exact date for Mark.
All right.
In fact, maybe he'll call himself in. I don't know.
All right. Well, anyway, those two names are going into the big cowboy hat, and we'll draw one out, and we'll see if you win LBD's second generation free cake.
7-inch cake.
Yeah. And it's
7-inch cake.
Brian, if you won it before...
Chocolate or vanilla?
Well, whatever you want. Have you won it before, Brian, or known somebody that's won?
I've known lots of people that have won, and this year I won.
That's right, you did win.
The first time ever.
Right. Well,
it was rigged.
That's it. I actually drew his name. I think you were not in that night.
No, I didn't want to be part of it. I said, if there's people going to go to jail, I don't want to be part of this.
There was no hanky-panky going on. I truly pulled his name out of the cowboy hat.
Did.
And there you go. So, Brian, thank you.
Last week, Bill pulled my entry out of the cowboy hat. So I let her know right away. She was a friend of mine, a classmate of mine who won last week.
Well,
And naturally, Bill said both the first and last name.
I'm telling you, that is
We'll
acceptable
overlook that.
in modern radio.
We have a station policy.
Who you do?
This is going to get
Well-
this is going to get boring. So we're going to end it there. We're going to
Oh, the humanity!
yeah, we're going to go back to talking to our guest for the remainder of.
Thank
of
you
this
very
hour.
much, Brian, and good luck.
Thanks for calling in,
Good
Brian.
night, gentlemen.
All right.
Talk to you soon.
Have a good night.
Bye bye. All right. He is a good guy and a good. He
And,
takes
Billy,
it right from
but-
us. He takes.
Yeah, he does.
takes
But,
it.
you know, but that tells you though, you have to call to win. Because Jerry his birthday was April 15th when he turned 90, and he was a
And Jerry
lucky
won,
recipient
too.
of a
Right.
cake.
Yeah. So, hey, we bring good luck to people.
You
Anyway,
do, Billy.
Yeah, let's go. Hey, now, so as I look at this announcement of the Kiwanis Club of Haverhill's third annual turkey drop, which is coming up this Saturday, November 10th, 1 p.m. at Murphy's Garrison Golf on Hilldale Avenue in Haverhill. There are other people that event sponsors and some special thanks. Would you like to go through any of those?
Sure.
Or you want me to do it? You can.
No, I got it.
You go right ahead.
We have our event sponsors, which are people who basically donated some money to help us get this off the ground, I guess. Haverhill Bank.
Literally.
Haverhill Bank, Pentucket Bank, Deborah Connor, CPA, Galinsky Plumbing and Heating, Holy Family Hospital, Farmer and Sons Funeral Homes, Ram Engineering, Caitlin M. Macy's Esquire, and the turkeys were donated by Favorite Foods in Somersworth, New Hampshire. Then there are Kiwanis members who also gave, myself, George Fahey, Frank Pilaria, and Fred Sarome. And special thanks to people who have helped out, Linda Urban and Kelly Donahue. Boston Helicopters, as I said before, Giselle, great pilot, going to do a great job. Hampstead Plumbing, Print and Copy, who printed the tickets for us. Of course, Murphy's Garrison Golf, who, when we first needed a place, they looked at me and said, "You're crazy, but okay." Ted and Mary Murphy, and of course WHAV. I'm hoping somebody will be there to broadcast live. We don't know yet, but it's going to be a fun day. And you know, those are the people. And as I said earlier, some of the prizes were donated and by the entities themselves. And some people have purchased them and given them to us.
Yeah, and somebody's had to go out and hustle those prizes and get the people to donate. And it's not an easy thing to put together something like this.
It's not. And fortunately, you know, I have good club members with me, and you know, they all, as we said, you got a favorite place that you go. When you're there next time, just say, "Can we get a couple?" And you know, $10 is. And that's the thing. $10 is the cost of the ticket. So if it's a $10 thing, at least people get their money back.
Now, do you encourage people to come out and watch?
Absolutely. I'd love to have people come and watch. And actually, my thought is in the next couple of years we can make it bigger than just the drop itself, and you know, have some other activities going on.
Now, do you have a rain date? Because I'm sure the helicopter won't go up in inclement weather.
We don't, and it's his call as the pilot. Wind, obviously, and rain. Last I saw, the rain was supposed to, you know, ease off in mid-morning. I'm hoping that if we do have to cancel on Saturday, that we can just move it to Sunday. And we, you know, you can get that information. We'll get that out on Haverhill Kiwanis. I believe it's haverhillkiwanis.org is our website. But if you just do a search for Haverhill Kiwanis, it will come up.
Great. All right.
Where do you get the turkeys from?
He said
I purchased them online, actually.
Really?
Yeah.
Favorite foods.
Well, Favorite Foods
No,
donates
not the edible ones. Do me a favor, let him win a rubber one.
Oh, you mean the rubber ones?
Yeah.
I didn't know you were asking about the rubber ones.
I did. I understood where he was coming from.
See,
I
Billy,
purchased them
I'm
online.
glad somebody else understands.
Yeah.
I try. I do try.
So you bought them online, because I wouldn't think there would be much of a demand for rubber turkeys anyway.
Surprisingly, there's not, but surprisingly, when I first did the search for them a couple of years ago, they popped right up, and I don't even remember the name of the company that I bought them from. But, you know, we take them. This year we bought some new ones because the last ones got pretty beat up, and we put sand in them so that they'll drop quicker and more steady. Otherwise, the downdraft of the rotors will move them around. And nobody stands near when we drop them.
Yeah, how close is anybody to it?
We keep people back quite a distance. I'm the closest at about 150, 200 feet. And until I get the thumbs up from the pilot, he won't drop them. So until he gives me that, if he doesn't, I got to move people away.
Yeah.
Well, it sounds like a good event.
Oh, it's a lot of fun.
Yeah. I might show up.
Well, we'd love to have you there.
Let him be in the ring.
I'll play
We'll put him out there with a basket
I'll
trying
play
to catch
Les
him.
Nessman.
I'll give you $20 if he can get hit.
Thanks. All right. Well, we want to thank you for all of your efforts to make this happen.
Well, thank you guys
I know
for your help.
Our boss, Tim Coco, is very much behind it. Do we have any more WKRP sound that you'd like to drop in, Chris, before we end up this segment? Go ahead, pick something up. Tim left a lot of WKRP sound for us to chuckle over, and it was a great half-hour sitcom, in case you don't know what we're talking about, WKRP. But it was about a radio station, and they did a sitcom about it.
Cincinnati.
And I could relate to a lot of it.
Actually,
WKRP
before you go,
in Cincinnati.
I saw something just recently that story was based on a real incident. In the real incident, they were actually throwing the turkeys out of a truck, but essentially had the same result.
Okay. Chris, what do you got?
The copter seems to be circling the parking area now. I guess it's looking for a place to land. No, something just came out of the back of the helicopter. It's a dark object. Perhaps a skydiver plummeting to the earth from only 2,000 feet into the air. The third. There's no parachutes yet. Those can't be skydivers. I can't tell just yet what they are, but... Oh, my God, they're turkeys! Johnny, can you get this? Oh, they're crashing to the earth right in front of our eyes! One just went through the windshield of a parked car! This is terrible. The cars running around, pushing each other? Oh, my goodness! Oh, the humanity! Oh, people are running about. The turkeys are hitting the ground like sacks of wet cement. I don't know how much longer the crowd is running for their lives. I think I'm going to step inside. I can't stay out here and watch this any longer. No, I can't go in there. Children are searching for their mothers, and not since the Hindenburg tragedy has there been anything like this. I don't know how much longer I can hold my position here, Johnny. The crowd...
All right, well, that's going to take us just about right up to time. This is the Open Mic Show on WHAV, heard every Monday night, 6 to 8, right here at 97.9 FM. I want to thank Rich Porcelli again from the Kiwanis Club, reminding you, don't forget, the third annual turkey drop is Saturday, November 10th. Be at Murphy's Garrison Golf on Hilldale Avenue at 1 p.m. and join all the fun and festivities, right?
Thank you. Yes, please come out.
All right. Well, thank you for being here. That's going to wrap it up for us tonight. Next Monday night, we're going to be talking about the election. We're going to be analyzing and discussing with some guests on what they think happened and why, right here.
And the only last thing I'd like to say is go out and vote tomorrow.
Right. Go out and vote tomorrow, early and often. And also, I want to thank all of the people that called in as our guests and people that called in just to be part of the Open Mic Show right here on WHAV 97.9 FM.
Open mic!
Join Bill Macek live on the Open Mic again next Monday night at 6. The Open Mic Show is brought to you in part by Smith Motor Sales of April, 420 River Street, exit 48 off 495. The opinions expressed on the Open Mic Show are not necessarily those of 97.9 WHAV FM, its underwriters, or affiliated stations. The Open Mic Show came to you from the Edwin B. Johnson Newsroom.